Thanks, Amanda. Summer is one of the best times to take a vacation with the family, but whether you are driving to grandma's house or flying to Disney World, you need to be aware of the health risks that can come with traveling. Joining us live over Zoom with more is Dr. Mark Passman, director of the UAB Vein Clinic. Thanks for joining us here on Alabama Live.
Well, thanks for having me. And yes, there's nothing that will ruin a summer trip more than having clot in your legs.
What kind of health issues can arise when people are traveling?
Yeah, so when clot develops in someone's leg, they may develop some swelling and leg pain, but more importantly, it can be a risk for clot traveling up to the lung, which can become a life-threatening problem. And certainly, people are at risk. In general, those that have had a personal history of clot in the past or family history may have some predisposing factors. But certain situations can amplify that risk, and travel is certainly one of those issues.
With that in mind, what should we be doing when we are traveling? How often should we take a break if we're driving and get out and stretch our legs? Or if we're on a plane, how often should we get up and walk up and down that aisle?
Yeah, absolutely. First, it's important to have awareness and know what your risk might be. And certainly for individuals who know that they have some clot risk, they may have to take some special precautions. But in general, the risk when you travel is there's periods of immobility, and certainly that immobility can lead to additional clots. So simple things like breaking up the trip, whether you're in a car or a plane, get out of the car to walk. If you're in a plane, maybe walk the aisles or pump your legs back and forth. Dehydration can amplify the risk a little bit, and so maintaining your hydration status. And then compression stockings, although it's a little warm to wear them in the summer, at least while you're traveling, they can help promote flow in the legs and prevent clot buildup while you're actually traveling.
You said it's important to know your risk. How do you assess that?
Well, you can assess it with your primary care provider, knowing your medical history and your family medical history. And if you go online and just search lower extremity deep vein thrombosis or clot risk, there's a lot of good tools out there that are in the public domain that folks can do a self-assessment of their clot risk.
We've heard of healthy people who develop blood clots. Is there anything that we can do? What should we look for? What symptoms should we look for?
Yeah, it can affect healthy people. Certainly people who are ill and in the hospital and needing surgery and critical condition are way higher risk. But folks that really have not had clot before can have risk and not know that. So again, just having a little bit of awareness of your personal history, the situations that you're in with travel and all, and just everyone wants to get to their destination as quick as possible, but just part of that adventure with the travel is making sure you take care of yourself during the trip and pausing a little bit in that trip to get to wherever you need to just take care of yourself and do these simple things: walk, hydrate, wear the stockings during the travel. It should reduce it in most people. Those that have a higher risk, in consultation with your doctor, you may need to be on the blood thinner anyways, or sometimes those that have really heightened risk need additional medical management with blood thinners. Sometimes taking an aspirin before your trip can offer a little bit of risk reduction.
At what point, when you notice these symptoms, the redness, the swelling, should you change course and head to the hospital?
Well, I think at any point after travel, it's unlikely to happen as you're traveling. It most likely will be noticed sometime after you get to your destination. But if you have unexplained leg swelling or pain, especially if it's in one leg, I would encourage folks to either consult with their doctor or go over to the emergency room. Testing is real simple. There's a little blood work that can be done. There's also ultrasound of the leg. If you have unexplained shortness of breath or chest pain, then you may worry, even in the absence of leg symptoms, that there may have been clot that traveled to the lungs. And in those situations, you should go to the emergency room so that the appropriate imaging can be done to diagnose whether there is a clot in the lung, pulmonary embolism.
Where can we go to learn more?
There are good websites in the public domain. At UAB, we have a Venus program, Venus interest, and we have a lot of information through the UAV system. But just in general, there's a lot of good information out there through various search engines online, and with some of the AI technology now, that information is pretty well presented to those that go look for it online.
Dr. Paxton, thank you so much for joining us here on Alabama Live and sharing your expertise with us. We appreciate it.
Well, I appreciate the time, and safe travels for everyone.